And of course, one of our top stories this morning is reopening day across the province. Some businesses like restaurants, gyms, movie theaters can reopen their doors today at 50% capacity. Gathering limits increased both indoors and outdoors. And this comes as a number of health experts say we need to soon focus on learning to live with COVID-19. So with that, Toronto's Medical Officer of Health, Dr. Eileen de Villa, joins me now live this morning. Good morning to you, Dr. de Villa.
Good morning.
This is a big day, a significant day, step forward, and hopefully we don't have to go backwards. So I want to get your take on the day and whether or not you feel Toronto is prepared in that we are going to be on the positive side of things.
Well, certainly at this point in time, as I've said a number of times now, we have reason to be cautiously optimistic. Certainly people want to see businesses getting back and activities and all the things that really enhance our quality of life in the city to resume. Let's face it, we all benefit from that. We know that we are still living in the midst of a pandemic, of course, but we are 2 years in and we've learned a lot about how to really effectively control this virus. We know how it spreads. And we have a number of tools available to us to help us control its spread from one person to the next. And we need to continue using those tools. So we've seen numbers improve. We've seen our COVID indicators improve over the last several weeks now. And in order to maintain those things and to continue to have access to those activities that we all want back in our lives, we need to continue to use the tools that are available to us. Vaccination and all those measures, particularly the self-protection measures that we know make a difference. I think that's what's going to continue to see us progress through this. And of course, the constant monitoring to make sure that we are aware of what changes may be happening with this virus. We've seen this as a pretty wily virus that mutates and new variants develop. These are the kinds of things we're going to have to continue to watch for in the weeks and months to come.
Dr. de Villa, I want to get your take on some health experts have been calling for fully vaccinated, that term to be changed to include that third dose. Boosters didn't really roll out for the general public until just recently for certain age groups. So do you think that it should be included in that term of fully vaccinated, number 3?
Well, certainly, Mel, we want to see people take up vaccine. And you're quite right. There is still, it's still relatively new for a number of people when you think about it. That's why I think at this point in time, it is important that we continue to really encourage people to get vaccination and that we ensure that all those opportunities for people to get vaccinated are widely available, regardless of where you live in the city, what your working hours are like, what your circumstances are like. For us, from the public health level, the local public health level, we're really focusing with our vaccination partners on enhancing every opportunity for people to get appropriately vaccinated because we've seen these vaccines are safe, they're effective, and they are making a huge difference in respect of this pandemic.
And we should note city-run mass vaccination clinics as of today. Walk-ins will be available for those 5 and up. And important to say the 5 and up. That's the age group, the 5 to 11, that it seems to be plateauing. Do you anticipate a climb here at all, or do you think that we're going to hover around this mark of just parents saying, you know what, I'm not going to get my youngster vaccinated?
Well, you know what, Mel, I can say this. When I look at our vaccination records for the City of Toronto overall, we've got more than 90% of our population 12 plus who has at least 1 dose of vaccine on board, over 87% with 2 doses of vaccine or more on board. This is incredible. We are a leader amongst large municipalities. And this actually took some time to get to. So I have no doubt the children's vaccine, the 5 to 11 vaccine, has only been available since late November. It will take us a bit of time. It's still only a few weeks that we've actually had this vaccine available for use here. And I know that if we continue to do the things that have worked for us, making sure vaccine is available, yes, in mass immunization clinics, but also in local, hyper-local, mobile pop-up clinics, clinics that are actually in the communities, in the places where people go, including schools when we talk about kids. This is the way to continue to drive vaccination efforts up. And you're going to see us work with all of our vaccination partners to make sure that access is not a problem and that we're really affording the ability for people to get that vaccine.
Dr. de Villa, we have run out of time, but I'd like to just ask you on a personal level how you're feeling, how you've been doing. We have not talked since the new year. We haven't talked since you've been very open and public about yeah, having a procedure done. How are you feeling? How are you doing?
Well, you know, Mel, I actually am very, very grateful to the people who took care of me. I'm feeling well and looking forward to continuing to just get us through the rest of this pandemic and hopefully start to restore life a little bit more like it was before we knew about COVID-19.
Wouldn't that be nice? Okay, Dr. Eileen de Villa, good to hear you're doing well. Thank you for taking the time today.
Thank you.